Before I suffered my stroke, I had a headache, constant headache for over 20 years. And I went to different doctors, and I would tell them what was going on, and they came up with this, well, maybe if you relax more, learn to relax more, you feel better, he said. It's just a yuppie sickness. I said, blacks aren't yuppies, they're buppies. And I said, this thing doesn't go away. Yeah. Wow. Bad. I used to put ice on my neck and my head.
Really?
Yeah. Did for years. I never got an MRI until I came up here, and Dr. Ferguson told me that I was going downstairs. And I said, going downstairs, I'll be late for work. He said, that's the least of your problem right now.
Really?
And he looked in my eyes and told me, you're going downstairs. That was it. And I don't remember anything after going in that machine. That was it for me.
That was the start of the two lost weeks?
Yeah.
Were you hospitalized for those 2 weeks?
Yes, I was in intensive care. They took a tumor out of my head about the size of an orange. I remember being at the rest home, and my wife, Phyllis, asked me, do you know who I am? And I kind of vaguely remember answering her, but I do and I don't. I was so bad I couldn't stand on my own.
Really? Couldn't walk?
No.
Could you speak?
No.
So you really had given up most normal function.
I didn't have any normal functions.
Yeah.
After he had the stroke, I really didn't understand stroke. You know, you don't understand it till then you live with someone with it. And I could see that he was damaged. And he kept saying he couldn't see me because his vision has been affected, and I knew the left side of his body wasn't working, and just a little bit of what Dr. Primrose had said to me, because I only got a few minutes with him and they were taking him to surgery to take the tumor out, and that was an all-day thing. But when he came out of surgery, I thought he looked great, and because he was alive. He was very swollen, and you know, it was major surgery, and he spent a week. He wasn't awake then. He spent a week in intensive care, and they were great in intensive care, the gals in there taking care of him. I'm very happy with the people here, with Dr. Primrose, Dr. Ferguson, with all the nurses. He was pretty ornery sometimes. It was very difficult. He didn't walk. It happened in June, and he didn't take his first steps until the following December.
I have good days and bad days. I have more good days than bad days. And I'm meeting a lot of my goals. But the people here, they believe in themselves, so they're good at what they do. And they're serious at what they do.
Oh, I think it was team care, team medicine. They all had communication.
Yeah.
And it was different doctors, you know, from the department that came through on the rounds. So, and then there was the Maria, I believe her name was, the physician's assistant up there on the same floor with Primrose and Elliot.
I think about him all the time.
From how he got knocked down, he's doing very well.